Hello and good morning or good afternoon to you, wherever you may be. Thank you for joining us today for our special presentation of Critical Coding and Billing Changes in 2023 webinar, presented today by Rectangle Health. My name is Jacob Borkover here with the webinar team at Rectangle Health, and really want to just thank you for taking time out of your day to be here with us today. So before we get into our presentation, just a few quick housekeeping notes here. This is a CE course, 1 CE credit. We are PACE accredited through AGD to provide CE, so you will be receiving your CE credits within the next 2 weeks. So keep an eye out on your email. Sometime in the next 2 weeks, that'll be hitting your inbox. If you're joining us from mobile today and you can get to a desktop, we do recommend that. It is a better viewing experience for you. We're going to have a survey at the end of the presentation, so we're going to post that link in the chat, and then it'll also pop up once you exit the webinar. Please fill out that survey so we can get feedback on how we did, and so we can hear from you a little bit more about your experience today. We are going to pick 3 lucky random survey respondents to get an Amazon gift card, so just added incentive for you to fill that out so we can continue to learn and improve. We are going to have 3 polling questions today. It's important you filled that out as part of getting that CE. We need to know that you are here and paying attention and interacting with us at all times possible. So last note, our next webinar is February 7th. It's a HIPAA and cybersecurity webinar. I'm going to put that link in the chat so you can register. And then we're going to send everything after the webinar. So you're going to get an email with all the follow-up resources, everything we talk about today, including the recording. It'll all be in that follow-up email. So just keep your eyes out later today for that email as it comes in. Exhale. Okay, my long spiel is over. Now it's my great pleasure to introduce 2 great friends to us here at Rectangle Health. Mr. Steve Anderson, the founder of Total Patient Services Institute, Crown Counsel, and the Smiles for Life Foundation, and Pam Peterson, who is the president and CEO of Total Patient Services Institute. And today she is the messenger of codes, as she likes to say. So Pam, Steve, take it away.
Jacob, thank you, and great to be with everybody today for this most exciting topic of insurance coding. So here's the benefit today. Not only are we going to talk about things that have changed for 2023, which there are a few codes that have been added, some that have been deleted, and in addition to that, we're going to talk about common insurance codes, procedures that are miscoded. We'll talk about common procedures that are not coded at all that you can add to your coding regimen. We're going to talk about how to get paid faster and how you can have single submission claims, so you're not having to resubmit and resubmit. Plus, we're going to talk about some verbal skills that you can use with some of the most difficult insurance questions, like, do you take my insurance when you may not? So this is going to be a packed time here together with far more than just coding changes. There will be things here that will add to your productivity, your profits, and also your skill in delivering total patient service. So with that, Jacob introduced Pam Peterson. Pam and I have been colleagues for over 20 years. Pam leads the Total Patient Service Institute, which is our coaching and training organization focused on helping dental teams deliver the highest level of patient service and delivering the best case acceptance. And certainly all of this falls in that category. So with that, Pam, welcome. And you are going to start by sharing with us what has changed for 2023.
Perfect. Thank you, Steve. And just like Jacob said, I do coin myself as being the messenger of codes. We know how busy you are day in and day out, and trying to keep abreast of what's going on with codes can be cumbersome. So we are happy to do it for you. So first, before we talk about what has changed, I want to talk about where the codes come from and who are the mysterious people that are supporting us. This committee is called CMC, which is Code Maintenance Committee. This committee is formed from the American Dental Association, and their sole responsibility is to take a look at the codes, and they're advocates for you, the dental practice, your patients, and the third-party payers. And so the code maintenance committee, they will delete codes, add codes, and sometime revise. And so now we're going to talk about the changes ahead for 2023. Next slide, Steve. All right, so there was 22 codes added and 2 deleted and 1 revised. So let's talk about what was added. Next slide. All right, so diagnostic, what was added are the tomosynthesis codes. And what this is, it's a stationary intraoral scanning system. And so D072 is a comprehensive radiograph, and that is a full mouth series. The D0373 are bite wings. The D07374 are PAs. And of course, the 387 is a pano. So these are brand new, and this is the stationary scanning system. Next slide, Steve. These are scanning codes as well. The difference is you'll see capture image only. So if a clinician is remote, which many of you do teledentistry, if the doctor is not in the practice and he or she is reviewing the scanning radiographs, these are the codes that you use. For bite wings, it's D0388, and for PAs, it's D0389. Now, whether you are in network or out of network, if you are submitting on behalf of the patient, you want to make sure that you add in box number 29 on the claim the quantity. And I'm going to say this multiple times as far as where you add things on a dental claim, and we'll talk more about this a little bit later, because the insurance agent, they operate on volume. So they don't really read a lot of notes, they look for boxes. So you want to make sure that you add your quantity in the correct place, which is box 29B. Next slide, Steve. All right, these 2 codes were deleted. These are 3D photographic images, the D0351 and the D0704. And the reason why these codes were deleted is the code committee felt that these did not accurately document what the procedure was. So here are the codes that they replaced these 2 deleted codes with. Next slide, Steve. The first is 0801, which is a surface scan direct, which is, I know you're dental people, so you know that means outside of the mouth. The D0802, which is indirect, that's a scan. The 803 and the 804 is a facial scan. Now, this facial scan is similar to a mammogram. So these are the new codes that are specific based on what you're doing, whether it's indirect or direct, whether it's in the mouth or outside of the mouth. Next slide, Steve.
Oh, that's
right.
a lovely
now when you
picture,
see this, yes.
Wait, I thought
so
this was about coding, not injections.
You know, it is about a vaccine, but it's not in the mouth. And I got to explain this. With ADA, ADA set a goal in pursuit of the whole patient's health. And so with that being said, there were 3 vaccines that were added, which is the HPV, and it comes in 3 doses, dose 1, 2, and 3. So 1781 is for the first dose, 1782 is for the second, 1783 is for the third. Now, if you're thinking, okay, what does that have to do with dentistry? Well, the ADA, through research, 70% of HPV diagnoses are linked to oral cancer. And when ADA stated they set a goal for in pursuit of the whole patient, they know that patients are more inclined to come to the dentist than they are their primary care physicians. Now, just because these codes have been adopted does not mean the dentist has permission to do today if this is something you choose to do in your practice. Currently, there's only 2 states that have been approved, and that's Illinois and Oregon. So in the event that you decide on something like this, it must be state approved. So just keep an eye on that if this is something that you are interested in. Next slide, Steve. The 7 vaccines that were introduced as far as COVID vaccine. There's Pfizer, Moderna, and Janssen. And these are the initial vaccine and the boosters. Now, why ADA felt the need to introduce this and approve for in the dental office is they felt that if a dentist can perform an alveolar block, which is a very difficult shot in the mouth, that you definitely can administer a vaccine. So in the event that you choose that this is what you want to do in your practice, there's a simple process that you'll need to do, which is to be certified in order to administer the vaccine in your practice. And so 1708 is for the first dosage for Pfizer, 1709 is the booster, 1710 is for Moderna, which is the initial, 1711 is the booster, 1712 is a booster as well. There's 2 additional. Can you advance to the next slide, Steve? For pedo, for pediatric, the codes are different. The D1713 is for the first dose, and 1714 is for the second. So in the event that this is something you're interested in, these are the codes that have been approved for this for 2023 in the practice. Next slide, Steve. So there was one code that was introduced that's new for perio, which is the D4286. This is the removal of non-resorable barrier. Why this was implemented this year is there was one code for non-resorable and resorable, and the ADA and the code committee felt that it really needed to be specific based on what the clinician was doing. So now there's a code for resorable, and this is a new code for non-resorable barrier, which is the D4286. Next slide. All right, there's the perio code. This one was in the middle of everything. It wasn't launched with everything else, and we were excited to make sure that we add this one because it's frequently used. This is a D4233. This is a full mouth debridement. And so this enables a clinician, whether it's the doctor or the hygienist, to actually see what needs to happen for periodontal evaluation. Now, why this code has changed is it can no longer be followed by a D150 or periodic exam. The only way this code will be approved, it must follow a D0180, which is a periodontal exam code, which I'm going to talk about a little bit later in the slide deck. So this is an update revision, which is the only revision this year, which is the D4233. Next slide. So what's new on the implant side? The first one is the D6105. This is a removal of an implant body that's not requiring bone removal or flap. So if it's not surgically needed to remove the implant body, this is the code that you would use, 6105. Prior to that, there wasn't a code. It was an all-inclusive code, and a lot of times payers would just deny it, especially if you didn't put a narrative as to why. The D6106 and the D6107, these are both guided tissue regeneration. And the difference between the two is one's resorable and the other is non-resorable. And you have to make note of it that this is per implant. The 6197, this is the new code, and it's the replacement of the restorative material really to close the access. And prior to this, many practices would have to use a catch-all code and have to write a huge summary. Now there is a code for exactly what you are doing, which is the 6197 to close the access. Okay, next slide, Steve. So in oral surgery, this is Steve's favorite, the D7509, which is a marsupialization of otogenic cysts. He loves
a marsupial.
In layman's terms, I know you're dental people, so this won't gross you out. So in layman's terms, this is a cyst. If the patient has a pocket or a cyst, this is a code that you would use to drain the area in order for the patient to heal. And so it's a new code, so you no longer have to create an in-house code. You can use Steve's favorite code, which is the D7509. Next, the 7956 and 7957 are both guided tissue regeneration. And the difference, you'll notice that there's a trend. One is resorable and one is non-resorable. And these are for edentulous patients where if you were preparing for after a tooth extraction or any type of all on fours, these are the two codes that you would use based on the barrier that you would use. Is it resorable or non-resorable? Sorable, and this is the code that you would use. Next slide. All right, so let's talk about what's next. So we're going to talk about some codes that are frequently used that you see day in and day out, and then there are some that are used incorrectly. And as I go through these, I want you to think about what you're doing really well. Give yourself a check mark. The area that need improvement, make your notes. And if there's some things that absolutely you need to stop, go ahead and stop it. So let's do a little checkup on your codes. Next slide, Steve.
This one, Pam, is the word of caution here, because some of these are common habits that everybody does.
Great.
And just because everybody does it doesn't mean you should be doing it. So this one, and this is a big one. Everybody does.
Real quick,
Okay.
Pam, would you mind turning off your camera just so we can get a little bit crisper audio? You're cutting in a little bit. So if you could try that, that'd be great.
Turn my camera off.
Yeah. See if we can get some better audio.
All right, let's see.
So while you're doing that, Pam, I'll lead off on this. This is a commonly made mistake, is when you have a patient that is on perio maintenance. So, and every visit they have, let's say they have 4 perio maintenance visits per year, then that would be 4. Every time they come in, it would be a 4910. But what if their insurance doesn't cover 4 visits? So one of the miscodings mistakes that we see is that practices will alternate the 4910 with an 1110. So every other visit, they'll code it as an 1110 because their insurance doesn't cover the 4910. So the rule is code what you do and do what you code, right? So you're always going to tell the truth, and whatever service you provided, that is what you're going to code. So in this case, if it's a perio maintenance visit, it would be coded a 4910 every single time, because unless you deem that they are no longer a perio maintenance patient, and you're going to switch them back to an 1110, but in insurance terms, once 4910, always a 4910, you're always going to be doing that perio maintenance. So always code it a 4910, and then in the notes, when you submit the claim, you can write a narrative that says, if 4910 is not allowed, please use the alternate 1110. So you let the insurance company make the change, but you code what you did. How'd I do, Pam? Did I do pretty good on that one?
You did excellent.
So put it in the narrative, but always code it for what it is that you're doing. All right, let's talk about exams, Pam. This is great. These are exam codes that are underutilized. Usually that can help you out a lot. Go ahead.
Okay, and then let me know if I freeze, and I do want to apologize. I wasn't aware of that.
All
right.
good.
So I'll go slower. All right, so the codes D0120, D0140, D0150, which is a periodic, limited, and a comprehensive exam, frequently used. So many are very familiar with that. We're going to talk about the 3 codes that aren't used as often. So next slide, Steve. The first one is the D0160. This is an exam code used after a comp exam or a periodic exam. It's not a standalone exam, which means it must be followed by a comp or a periodic exam. There's some frequently limitations on the D0160. Most payers will pay twice a year, and you must always put in the narrative area your reason for it. So this code is used when a second evaluation is necessary. A lot of times when patients come in and they haven't been in for a while and it's an extensive treatment plan, an example would be TMJ. This is the code that you would use when the patient returns. So you no longer have to create an in-house, what we call a dummy code to get the patient to come back. This is the code that you would use, and there is a fee attached to it. Next slide, Steve. The next one is the D0170. Both codes, the one that you just saw, can be used with established and new patients. This patient is a reevaluation of a specific problem because definitive treatment has not been rendered. Now, this code can be used for tissue or trauma. Most of the time, this code is miscoded because it'll get confused with the D0171, which is a post-operative code. So the D0170 is when you bring the patient back because definitive treatment has not been rendered. An example would be if a child hurts himself on a playground, chips a tooth, brings them in, the doctor evaluates everything, gets them in good standing, and would like to see them on a follow-up visit. This is the follow-up visit code that you would use, the D0170. Next slide, Steve. Next, which is miscoded. Earlier, when I talked about the D4355, the debridement code, and I said it must be followed by a comprehensive periodontal evaluation code, this is the code. Now, this code can be used with existing and new patients. Now, this code is used when patients present themselves with high risk factors for gum disease or have inflammatory markers, high risk such as hypertension, diabetes, high cholesterol. This is a code that you would use, the D0180, and it's a comprehensive periodontal evaluation of with a new or established patient. Now, when you use this code, documentation must follow. In order to use this code, whether you are in network or not, if you are submitting on behalf of your patient, you must send in 6-point measurement, a good perio charting of every tooth, bleeding points, furcation, gingival attachment, and a great full mouth series. When I say great, it must be legible so that they could actually see what you see, and that must accompany the D0180. Okay, next slide, Steve. The next underutilized codes and how to use them correctly. Let's talk about some X-ray codes. So the D0220 and the D0230 are frequently used. The one that's used the most is the 220. These are PA codes, and a lot of times what we've seen when practice advisors, when they're going in a practice and they're taking a look at why practices are struggling as far as non-payment, the D220 will have, it'll be on the actual claim, and it'll have 5 or 6 X-rays. You want to make sure that when it's an additional PA, you use D0230. So the first PA would be the 220, additional would be the 230. And you want to make sure in box 29, place the quantity so that whoever's reviewing the claim will look at the box and send your claim on for payment instead of denial. Next code, I'm sorry, next slide. All right, so the buildup codes, the D2950 and the D2949. What's frequently used is the 2950, And this code is for retention. The D2949 is used to restore the tooth. An example would be if it's an endodontic tooth. Now, a lot of payers will send it right back to you and say D2950 or 2949 is inclusive of the crown, and we still recommend that you separate. You bill out and you submit to insurance the crown code, you bill out and you send in the build-up code. That way you can stay true and keep up with your standard of care. Next code, next slide. All right, Steve, you want to talk about doing it right the first time?
You got it. So this is in an effort when you do things the right way the first time, you don't have to do them again. So we're going to give you some tips for saving a tremendous amount of time by doing things correct the first time. So first tip is making sure that you are in compliance across the board with HIPAA, OSHA, PCI compliance, that you're doing things the right way in the first place. So that means up-to-date policies and procedures. That means emergency planning, doing the proper training of your team, that you have cyber liability insurance in place, that when you're sending claims and you're communicating, that you have the correct data encryption, that you have offsite backups so that if anything happens to your system, you can restore it and not be compromised, that you have your business associate agreements in place with any vendors, and that you have an annual HIPAA risk assessment done so that you cover all the bases. This is all a part of doing it right the first time. So Jacob, I believe you have a poll question for this one.
I do. All right, just to make sure you're engaged here. Would you like help with your 2023 HIPAA risk assessment? If you haven't done one already, more than likely haven't, since it's just at the start of the year. So make sure to put yes, no, or I'd like more information. We'll give everyone a few seconds here to get those in. All right. All right, and we'll close it out. All right, back to you, Steve.
Okay, let's make sure that everything works. When you did your poll, things kind of went haywire on my side. So, all right, got your poll. Thank you, Jacob. Okay, let's talk about, Pam, this is one of my favorite acronyms, and we probably have some people from Ohio that are on the webinar today. So this is about doing it right the first time. And Pam, tell us about Ohio.
Happy to do it. Would you mind advancing your slide?
You got it.
All right. While you're advancing the slide, Ohio, only handle it once. Can you hear me okay?
Yes.
Yeah, we can hear you, Pam. Steve's screen froze for a second here. Oh,
yeah,
there.
I'm fixing that, so coming up.
Okay, perfect. So I'll talk about only handle it once, and then you can get back to the slide. So what we found with Ohio, it's a great acronym to help you remember. When you only handle it once, it will allow you to do all the things that you really enjoy doing it. So you do it right the first time, and you don't have to worry about the cleanup afterwards. And so this is attached to our claim processing, only handle it once. Now, the first thing, while Steve is getting back to his slide deck, I want you to take a look at your claim form that you are using in your practice. And this is applicable to you whether you are in network or out of network. If you file on behalf of your patient, it's important to use the right claim. You see the arrow on the bottom left, your claim should say 2019 American Dental Association. Now, I know you're thinking 2019, it's 2023. It's rare that the claims are updated. The last time this was updated was 2012. And so it's just important to know that we're using the right claim, which is the 2019, and it says American Dental Association, which is ADA. All right, next slide, Steve.
Now, is the claim up on the screen?
Yes, I see the claim.
Okay.
Yes. All right, so let's talk about boxes on the claim. When I shared earlier that when your claims are being viewed, they're not looking at it thinking, do I like you or do I not? It's volume. And so they look to make sure that we're writing in the right boxes so that they can get them done really quickly. So box 33, any missing teeth. Box 35, that's where your narrative and your remarks will go. Next slide. 36 and 37, this is signed treatment plan, fees, and authorization of benefits. Now, when your patient first complete their paperwork in your practice, you have an internal financial guidelines, which all your team members know about. You also have external, which is what you share with your patients. At that time, they sign and give you permission to submit and collect payment on their behalf. So a lot of times when you see claims, practices will have signature on file. So you have to make sure that your patients are signing this when they complete your new patient paperwork. Also, box number 58, it's not uncommon for more than one treating doctor to work in the same location. You want to make sure that in 58, that's the treating dentist information, not the owner of the practice if there's multiple providers. Next slide.
All right, this is about getting paid today. So these are tips for making sure that you speed up the payment process, not only from insurance companies, but also from your patients. So Pam, let's run through the list.
All right, here are some things that may be a no-brainer, but it's often missed because we're moving too fast. Number one, the claim filled out properly, correct procedures listed, the claim filed and submitted within 24 hours. That's Ohio, only handle it once. Correct documentation sent with claims. It's not uncommon for someone to move really quickly and not send what's needed. So then you get a stack of EOBs that will bury you. So you want to make sure that you send the correct documentation with the claim and review the claim submission status, which I'll share in just a second. All right, can you advance to the next slide? Here are 3 reports, and you can go ahead and put all 3 on, Steve. This is the first thing that we look at when we're working with the practice health. We know that schedule, produce, collect are the 3 pillars of a healthy practice. So let's talk about collect. Collect in the areas of the 3 reports. The first thing that we look at is to make sure that these 3 reports are blank. It doesn't matter what software you are using in your practice. All software, dental software, have the ability to give you this information that I'm sharing. Number 1, insurance claims not sent. Number 2, if there's any procedures not attached to insurance. And number 3, secondary insurance claims not sent. Whether you take secondary insurance claim or not, we still recommend that you run the report. You would be amazed of what shows up on these documents that you didn't intend for it to show up. So the goal is for all 3 of these reports to be blank. And the key word is daily. Only handle it once. Just take a look at it daily, keep it clean. That way you don't have to worry about getting paid. Next slide, Steve. The submission status. This one isn't talked about much, but this is how we feel. The woman on your right that is out looking for a claim, wondering, I know I submitted it, where did it go? You don't ever have to stand on top of a mountain and look for your claims anymore. You want to check your reports to make sure that it went completely through when you submit a claim. So number 1 is the validation report. So when this validates that the claim has been submitted, and if there's anything that's picked up as far as what's not attached, or if there's something missing, the first thing you'll receive is a warning, and then the third is a rejection. This is before it even leaves your practice to go to insurance. The second is confirmation. This confirms that it did go through. The third is what we want. Clearinghouse means it successfully has been sent to insurance. So it's the validation report, confirmation, and clearinghouse. The validation report gives you 2 warnings to clean it up so that it goes to the clearinghouse. Now, if you're working with, which most of us are, a third party to help with this process, which is to get your claims from your practice to insurance, you want to make sure that you check these reports to make sure that they are functioning properly. Next slide, Steve. All right, here are some do's and don'ts. Never include anything that's not documented in the clinical chart. Number 2, use proper spelling and punctuation and grammar. Number 3, avoid handwritten narratives. You want to make sure that it's legible and that whoever's reviewing your claims that can actually read what you are writing. And last but not least, omit irrelevant, unnecessary comments. You want to put logic, not emotions, when you are sending a narrative to the insurance company. Next slide, Steve. All right, and I know many of you are like, okay, now what? In Texas, we believe that you get more bees with honey. So never use, you're like, I don't want any bees, but never use aggressive language or statements that would challenge the expertise of the consultant. You want to get them on your side so that you can take care of your patient and get paid. The next is you want to include clear diagnostic quality radiographs, and don't send the original. You want to make sure that you label them, make it easy for the consultant that is looking for your claims. So all he or she needs to do is approve your claim. All right, back to you, Steve.
All right. So on getting paid on the patient side, so we've talked about submitting claims so you get paid from the insurance company, also making sure that the patient portion, and this is just a quick little snapshot from our financial arrangements course. We call it the patient portion. We do not call it the patient's out of pocket. Out of pocket creates a vision that you don't want your patients to have, right? So it's the patient portion. So what are the components of a great payment solution for your practice so you make it easy for your patients to pay and you can collect immediately? So some of those aspects are making sure that you reduce the administrative burden, that you are constantly decreasing your accounts receivable. So we always say that there is never a collections problem. There is a financial arrangements problem. So if you have a lot of accounts receivable, it's not about just collecting, it's about how you're setting things up to begin with. Cutting costs associated with any type of paper that might be associated with it to cut down on that. Create a great patient experience as well as loyalty from your patients. So those are some characteristics of a good payment system. And you should be able to create customizable messages. You should be able today, with all the technology that's available, create digital patient registration and a text to pay option, which makes it really, really easy for your patients to pay either remotely or even while they're standing there in the office, have flexible payment plans, and be able to have a card on file, excuse me, that is PCI compliant. So there is a way to store credit card numbers. You cannot have them on paper and you cannot have them in a place that anybody on the team can even see them, but there is a way to securely store them so that you can run a card on file. So Jacob, I believe you have some polls on this.
I do. Okay. The first one is your text to pay compliant? Yes, unsure. I don't have text to pay. Get in those answers. And then we're going to do one more after that. So make sure you're getting in answers so that we know you are here and paying attention with us. And I see by how many of you are answering this poll that you are with us here. So, all right, give it a few seconds. Okay. Only 25% said their text to pay is compliant. So for those of you who didn't, definitely have to work with you to make sure we can get that all squared away. All right. And our next one is, does your payment system integrate with your practice management software? Yes, no, unsure, but it sounds like it'd be a nice benefit. All right, we'll give everyone about 10 more seconds here. Okay, it looks like about 58% have their payment system integrate, so very interesting.
Good deal. Thank you, Jacob. All right, let's talk about some verbal skills, Pam. This is one of our most popular things that we do. So grab your pens, and I'll actually take out your phones here, because in just a minute, we're going to give you a resource that you can tap into. Will help in your insurance collections and patient interaction efforts. So whether you're in network or out of network with any particular insurance, one of the biggest missed opportunities is in how you respond to this question if the patient doesn't happen to have insurance with which you're in network. So Pam, would you be the appointment coordinator here in the first round? I'll be the patient, and you answer this question the wrong way.
Okay.
Would you do that? So I'm the potential new patient. I call up and I say, do you take my insurance?
We take a lot of insurances and some we don't.
Okay. Well, do you take mine?
What insurance do you have?
MetLife.
No, I'm sorry.
Okay, thanks. Bye.
We don't take it.
So,
okay. Bye-bye. Thank you.
So missed opportunity, and here is the point, which is just because you're not in network doesn't necessarily mean that the patient can't come to your office. So here's what I'd like you to ask yourself. How many patients do you have that have insurance coverage, dental insurance coverage, with a insurance that you're not in network with, but they come to your office and you're able to help them with their out-of-network benefits? How many patients do you have like that? Now, if you're like most practices, you have a lot. So that being the case, listen very carefully to how we recommend that you respond to do you take my insurance? Now, Pam, would you like to be the patient this time?
Yes.
All right, here we go. I'll be the appointment coordinator this time, and let's see if we can bring this in for a landing and make you a new patient, even though we are not in network with your insurance. All right. So ring ring. Thanks for calling ABC Dental. This is Steve. How may I help you?
Hi, Steve. My name is Pam. Do you take my insurance?
Well, thank you very much for calling, Pam. So Pam, tell me who your insurance benefits are with.
MetLife.
MetLife. Great. Well, Pam, you are in luck. We happen to have a lot of patients who have MetLife benefits. And they come to our office. Now, we don't happen to be contracted with MetLife because we are an unrestricted provider, which means that we work with all types of dental benefits. So would you like to know why our patients with MetLife benefits choose our practice?
Yes.
So what our MetLife patients tell us is that they prefer Dr. Jones because of the quality of service that we offer in our practice and the clinical expertise that Dr. Jones has. And they value that. In addition, we help all of our patients file for their insurance benefits so they can get the maximum reimbursement that's available to them. So why don't we go ahead and schedule your initial visit with Dr. Jones? Would a Tuesday or a Thursday be better for you?
Tuesday Stay.
All right. Now I'm going to stop there and let's go back and analyze this real quick. Now here's my point with this is there's no one answer that's going to result always in the response that you want. But this works far better than just saying, no, we don't take your insurance. A no means an end to the call. So first thing is obviously you're going to ask them with which insurance company do you have your dental benefits, and then they tell you. And if you're not in network with that particular company, then you have to ask yourself this question is, do we have patients that have those benefits? And if you do, then you can say, we have a lot of patients with XYZ benefits. And then we always tell the truth. You can say, in fact, we're an unrestricted provider, which means we can work with all types of benefits. We don't happen to be contracted with XYZ. So would you like to know why our XYZ patients choose our practice? Now that question right there is the key. You have to ask the question to get engagement and their permission to move forward. So would you like to know why our XYZ patients choose our practice? And they will always say yes. Never found a case when they said no. And then you're going to say what our patients with XYZ benefits tell us. What they tell us is they prefer our practice because of Dr. Jones' uncompromising quality of care and our great patient service, or whatever other things you want to add. And in addition, we help all of our patients by filing for their benefits so they can get the maximum reimbursement that's available to them. And then just go ahead to schedule the appointment. So why don't we go ahead and schedule your initial visit with Dr. Jones and we carry on. So there's a lot packed into that response. And our recommendation is that you take that, you memorize it so that you own it. And then the next time a patient asks, do you take my insurance? And it's an insurance that you're not in network with, you have a great response that raises your chances of scheduling that patient. Just because they don't have insurance that you're in network with doesn't mean they can't come to your office. So with that, if you want to pull out your phone and you'll see in the middle of this slide, there is a QR code. And you're welcome to open your camera app and scan that QR code for a free download of our ebook entitled, Should You Be Insurance Free? And this ebook is filled with insurance-related strategies and how you should evaluate your relationship with the different insurance companies that you may or may not be involved with, whether you're in network or out of network. This is a strategy-driven ebook that will walk you through specific questions to ask yourselves as a practice on your relationship with insurance. You don't necessarily have to be insurance-free or totally contracted. There's so many different variations in between. But this ebook will give you strategic questions to ask so that you can evaluate your relationship with insurance moving forward so that you're on the right track for your market, your patients, and for where you want to take your practice. So you're welcome to scan that QR code, fill in the information, and you'll be provided a free copy of Should You Be Insurance Free? And again, packed with great insurance related information for your practice. So Jacob, with that, that covers the latest changes and updates on insurance coding for 2023, as well as a lot of other information on how to code correctly and hopefully avoid some of the pitfalls that a lot of practices make when it comes to insurance. So thanks for joining us today. And Jacob, I'll turn it back to you for any final comments.
Yeah, so thank you, Steve and Pam. Really great job presenting. And I can tell from the chat here that everyone is really appreciative and has a lot of good questions. Can we do 2 quick questions from the group here?
Yes, let's do it.
All right, perfect. I just wrote them down here. How does D4233 differ from D4355?
Ooh. All right, did you get that, Pam?
I'll take you back, Pam.
Okay, I'm sorry, can you repeat the question again? It was D4355?
Yes, versus D4233. Yeah, I had a few people ask.
So for 43, okay, so for 43, both of them they're similar. 4355 was specific to actually the periodontal code. Most of the time when you're using a debridement code, it's to enable the hygienist to make an assessment of which direction to take the patient. And so the 4355, that's what that code, that's the purpose of that code, and that's how it differs.
Okay, thank you. And we'll do one more here.
Okay.
Is it correct to tell patients they will maximize their benefits when you are not an in-network provider?
Right, good question. So what you're gonna do is maximize whatever benefits they have based on the relationship that they have with their insurance and that you have with their insurance. So the commitment is in network or out of network, you're going to help them to maximize their benefits. You have told them the truth, which is you're not contracted with MetLife, and that you do have patients that are MetLife patients that come to your office. So our rule is you always tell the truth, be very, very clear, and make sure they get the whole picture. They do have a choice, and most patients, many patients are not aware that they can go to the dentist of their choice. In most programs, in most coverage, they can choose their dentist whether they're in network or out of network.
Yes. And a compliment to the person who wrote in, they use maximized and not maxed out. We
Yes.
omitted the word maxed out, always use maximized. So a compliment to that person.
Very good. All right. Well, thank you. For those, I see a few more trickling in. If you guys have questions, we won't be able to get to all of them since we are running out of time here. So feel free when you get that webinar follow-up email from us later today, you can send those our way, and we'll be sure to get those to Steve and Pam so that you can get them answered. So with that, I want to thank everyone for being here today. The CE is officially over. Before you pop off, a few quick things just to go over while I still have you here. I did just post the links to a few things in the chat. So the link to our survey, it's very important that you guys fill that out so we know how we did. We did talk about good components of a HIPAA program and a payments program. So we have links if you're interested in learning more about that. You can click there for a demo. We also have the link to our February 7th HIPAA webinar, which is our next presentation we'll be giving. So feel free to take advantage of some of those resources there. As I mentioned before, all of this will be coming your way as well in your recap email, which will be hitting your inboxes in the next 2 or 3 hours here, along with the slides and recording as well. With that, I really want to thank everyone for being here today. As a reminder, also, we are going to be sending out CE credits within the next 2 weeks, so be on the lookout for that. We always get emails right after, where's my credit? Hang tight, we've got a lot to produce, so just make sure that you're taking a look at your inbox over the next 2 weeks and you will get that. We will be notifying 3 lucky winners for our survey. So 3 lucky random respondents who fill out the survey will be getting an Amazon gift card. So hopefully you'll get a note from us about that. And with that, we're going to sign off here, get everyone out 2 or 3 minutes early. So thank you guys so much for being here today. Steve and Pam, thank you once again for presenting. And with that, everyone have a great rest of your afternoon.
Thanks, Jacob.
Bye.
Thanks, Jacob. And please feel free to fill those questions to us and we'll be happy to answer them.
Perfect.